Hello and welcome back to my channel. Today we're discussing a common and important health issue, hypertension, also known as high blood pressure. This condition affects millions of people worldwide and if left unmanaged can lead to serious health problems such as heart disease, stroke, and kidney failure. If you or someone you know is dealing with hypertension, this video will provide essential information about the condition, its symptoms, causes, and management strategies. Hypertension occurs when the force of blood against the walls of your arteries is consistently too high. Blood pressure is measured using two numbers, systolic pressure, which is the pressure in your arteries when your heart beats, and diastolic pressure, which is the pressure in your arteries when your heart is at rest. A normal blood pressure reading is equal to or less than 120/80. Hypertension is typically diagnosed when readings consistently exceed 130/80 millimeters of mercury. Hypertension is often called the silent killer because it typically doesn't cause noticeable symptoms until significant damage has already been done. This makes regular monitoring and early intervention crucial for managing the condition and preventing complications. Most people with hypertension do not experience any symptoms, which is why it can go undetected for years. However, in some cases, individuals might experience headaches or shortness of breath. These symptoms are not specific to hypertension and usually don't occur until the condition has reached a severe or life-threatening stage. It's important to have your blood pressure checked regularly, especially if you have risk factors such as a family history of hypertension, obesity, physical inactivity, or a diet high in salt and low in potassium. Early detection and management are key to preventing the serious health issues associated with high blood pressure. Hypertension can be classified into two types: primary hypertension, or essential hypertension, and secondary hypertension. Primary hypertension has no identifiable cause and tends to develop gradually over many years. It is the most common type of hypertension and is often influenced by genetic and lifestyle factors. Secondary hypertension is caused by an underlying medical condition or the use of certain medications. Conditions that can cause secondary hypertension include kidney disease, adrenal gland tumors, thyroid problems, and obstructive sleep apnea. Certain medications such as birth control pills, cold remedies, and over-the-counter pain relievers can also raise blood pressure. Several risk factors increase your chances of developing hypertension. These include age, since the risk increases with age, and family history, as the condition tends to run in families. Being overweight or obese, not being physically active, and consuming too much salt, specifically sodium, in your diet can also increase your risk. Other risk factors include drinking too much alcohol, smoking, and high levels of stress. Diagnosing hypertension involves measuring your blood pressure using a blood pressure cuff and gauge. Blood pressure is typically measured in both arms to determine if there's a difference. Your doctor may take several readings over time to confirm a diagnosis of hypertension. Sometimes 24-hour ambulatory blood pressure monitoring is used to provide a more accurate picture of your blood pressure levels. In this way, we can see what your blood pressure is throughout the day, and also night. In addition to measuring blood pressure, your doctor may perform a physical exam and ask about your medical history and lifestyle habits. They may also order tests such as blood tests, urine tests, and an electrocardiogram or EKG to check for underlying conditions that could be contributing to your high blood pressure. Managing hypertension often requires a combination of lifestyle changes and medications. The goal is to lower your blood pressure to a safe level and maintain it to prevent complications. Here are some strategies for managing hypertension effectively. Adopting a healthy lifestyle is crucial for managing hypertension. One of the most effective changes you can make is to eat a balanced diet that is low in salt, saturated fat, and cholesterol. The DASH, or Dietary Approaches to Stop Hypertension diet, is often recommended for people with high blood pressure. This diet emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy products. Reducing your sodium intake to less than 2,300 grams per day, and ideally closer to 1,500 milligrams per day, can significantly lower your blood pressure. Limiting alcohol consumption is important, as drinking too much alcohol can raise your blood pressure. Men should aim for no more than 2 drinks per day, and women should limit themselves to 1 drink per day. If you smoke, quitting is one of the best things you can do for your heart health. Smoking damages your blood vessels and raises your risk of developing heart disease and stroke. If lifestyle changes alone are not enough to control your blood pressure, your doctor may prescribe medications. There are several types of medication used to treat hypertension, and they work in different ways to lower blood pressure. Diuretics, also known as water pills, help your kidneys remove excess sodium and water from your body, reducing blood volume and lowering blood pressure. Common diuretics include hydrochlorothiazide and chlorthalidone. ACE inhibitors, such as lisinopril and enalapril, work by relaxing blood vessels and reducing the production of a hormone that narrows blood vessels. Angiotensin II receptor blockers, or ARBs, like losartan and valsartan, have a similar effect by blocking the action of the hormone. Calcium channel blockers, such as amlodipine and diltiazem, help relax the muscles of your blood vessels. Beta blockers, like metoprolol and atenolol, reduce the workload on your heart and open your blood vessels, causing your heart to beat slower and with less force. Your doctor will work with you to determine the best medication or combination of medications for your specific situation. It's important to take your medications as prescribed and to have regular follow-up appointments with your doctor. This is to monitor your blood pressure and make any necessary adjustments to your treatment regimen. Regular monitoring of your blood pressure is crucial for managing hypertension. Keep track of your blood pressure readings at home using a home blood pressure monitor. Record your readings and share them with your doctor during your appointments. This information can help your doctor determine if your treatment plan is working or if adjustments are needed. In addition to monitoring your blood pressure, it's important to attend regular follow-up appointments with your doctor. These appointments allow your doctor to assess your overall health, review your medications, and make any necessary changes to your treatment plan. Managing stress is an important part of controlling high blood pressure as well. Chronic stress can contribute to hypertension and other health problems. Finding healthy ways to cope with stress can help improve your overall well-being and lower your blood pressure. Techniques such as deep breathing exercises, meditation, and yoga can help reduce stress. Engaging in hobbies and activities that you enjoy, spending time with loved ones, and ensuring you get enough sleep are also important for managing stress. Living with hypertension can be challenging, but having a support system can make a significant difference. Talk to friends and family about your condition and seek their support. Educating yourself about hypertension and staying informed can empower you to take control of your health. Your doctor can be a valuable resource for information and support, so don't hesitate to ask questions and seek their guidance. Hypertension is a serious condition that requires ongoing management and care. By understanding the symptoms, causes, and management strategies, you can take steps to control your blood pressure and reduce your risk of complications. If you suspect you have high blood pressure or have been diagnosed with high blood pressure, work closely with your doctor to develop a comprehensive treatment plan tailored to your specific needs. Thank you for watching. If you found this video helpful, please give it a thumbs up and subscribe to my channel for more health-related content. Leave a comment below if you have any questions or topics you'd like me to discuss in future videos. As always, take care of yourself and make the most of your day.